What do you know about allergies? When we hear the word allergy, we might initially only think of seasonal allergies and a lot of sneezing, itching, coughing, and just feeling miserable. But there are so many other culprits that can anger our immune system and trigger a variety of allergic responses in our bodies. Some of these responses are as harmless as watery eyes and a couple of sneezes during the pollen season, while others can potentially jeopardize our life or even kill us. Interestingly enough, for the past 3 decades, the number of people suffering from allergies has been on the rise. Nowadays, millions of people worldwide are suffering from different types of allergies, seasonal, year-round, or even lifelong. But what causes these allergies? Should we really curse Mother Nature? And why some of us suffer from allergies while others go about their day as if nothing is wrong? Do not miss today's video if you want to know the answers to these questions. Hey everybody, welcome to the ThinkLab. If you're new here, be sure to subscribe and hit the bell icon so you don't miss any of our videos. Let's get started. Allergies develop as a result of our immune system reacting to a foreign substance, commonly called as allergen. Allergens don't cause an allergic reaction in most people. In some others, however, they stimulate the immune system cells to release certain antibodies. These antibodies are known to cause allergic reactions. Based on the type and nature of the allergies, the symptoms can include diarrhea, vomiting, watery eyes, and nose, coughing, sneezing, and itching that leads to scratching. In some very rare cases, however, the immune system decides to take things up a notch and trigger a severe allergic reaction commonly known as anaphylaxis or anaphylactic shock. To fight off the allergen, which is usually food, venomous insect bites, or stings, or certain medications, the immune system releases a lot of chemicals in the body, causing the blood pressure to drop suddenly and airways to narrow, making breathing very difficult. In such cases, the patient is in need of immediate medical attention. If left unattended, anaphylactic shock could be very deadly. Some very common allergies that can cause our immune system to overreact include certain drugs and medicines, latex, pollen, bee venom, mold, animal dander, and food. Here the common theme is explosion. Our immune system mistakenly recognizes an otherwise harmless substance as an invader and tries to kick it out of the body. If the allergic response is caused by a certain food, the process of explosion includes vomiting or diarrhea, or both. If the culprit is seasonal allergies, also called hay fever or seasonal allergic rhinitis, the body will try to get rid of the allergen, usually grass or tree pollen, through sneezing and coughing. If it's an allergy to a certain substance such as latex, there will be a lot of itching and scratching involved. Allergies on the rise. Over the past 3 or 4 decades, there has been a rise in allergic reactions and asthma. This increase is linked to a number of factors including modern hygiene, tree planting strategies, and climate change. The hygiene hypothesis. Believe it or not, according to some scientists, the increase in allergies worldwide has to do with better hygiene. This belief is commonly referred to as hygiene hypothesis. It proposes that extremely clean environments fail to provide children with necessary exposure to particular germs and microorganisms that could otherwise educate the immune system to differentiate between harmless substances and harmful ones. Of course, not everyone agrees with this claim, but no one can deny that there is some truth in the hygiene hypothesis. After all, we might need germs just as they might need us. Tree planting strategies. In 1990s, Thomas Organ, a landscaper in California, noticed that some of his employees developed more severe allergic reactions when working under certain kinds of trees. After further investigation, he realized that the trees producing the most allergy-triggering pollens were male. This led to his discovery that most municipal tree plantings involve planting only male trees because the people in charge didn't want to deal with tree droppings. Organ later developed the organ plant allergy scale, or opals, a scale that helps guide cities to plant less allergic trees by ranking a tree based on its potential to cause allergy. Unfortunately, the process of implementing the opals is slow, and the already planted trees cannot possibly be cut down just because they cause allergies. The only thing we can do is replant with trees low on the opal scale. The blame's on us. There's another culprit. Humans. We are indirectly contributing to the rise in allergic diseases by directly contributing to global warming and climate change. Rising temperatures inevitably lead to longer allergy seasons, which in turn can cause more asthma attacks and allergies. You see, as the weather gets warmer and the air pollution worsens, plants will release more pollen for longer periods of time. High level of CO2 cause trees to produce pollen at up to 4 times their natural rate. But it doesn't stop there. Climate change also affects the production and protein composition of fungal spores and pollens, as well as the duration of being airborne due to changes in wind and rainfall patterns. These man-made alterations that we are so blissfully unaware of have a direct effect on the severity and frequency of allergic diseases such as rhinitis, allergic conjunctivitis, and asthma. As if that were not enough, the greenhouse gases too are capable of causing respiratory complications in people with asthma and chronic lung disease. So, we should keep on cursing Mother Nature for the ailment that befall us? Allergic treatment and diagnosis. Generally speaking, the best way to avoid an allergic reaction is to avoid the thing or things you're allergic to. But that's easier said than done, especially when you're dealing with seasonal or perennial allergies. If you're experiencing allergy symptoms, you should seek a specialist to determine if the condition you are suffering from is indeed an allergy. Your doctor will ask you questions about your symptoms and your family history and examine your ears, eyes, nose, throat, skin, and chest. They might also run some tests to make a final diagnosis. The most common allergy tests are skin prick test, STP, in which small amounts of possible allergens are placed on your lightly prickled or scratched skin to see if there's an allergic reaction in the next 15 minutes. Skin injection test, or intradermal skin test, where the doctor injects a tiny amount of allergen into the outer skin on your arm and examines the injection site for signs of an allergic reaction after a set amount of time. Patch test, in which your doctor places a small amount of suspended allergen on your skin and covers it with a bandage. You should develop a local rash after 48 to 96 hours if you're allergic to that substance. If the allergy results are positive, your doctor will provide you with a treatment plan to help control your allergy symptoms. Based on the NHS allergy guidelines, the most common treatments for allergies include medicines such as antihistamines and steroid tablets, creams, or nasal sprays for mild allergic reactions, and emergency medicines such as EpiPen or epinephrine injection for severe allergic reactions, and allergy shots that gradually expose you to the specific substances that trigger your allergic reactions over a period of 3 to 5 years, in an attempt to reduce these reactions or stop them altogether. So, are you among those who suffered from allergies, or are you among the lucky ones who can enjoy a beautiful spring day outside without worrying about runny eyes and a stuffy nose, helping themselves to some shellfish or perhaps a spoonful of peanut butter? Sign up below and let us know your struggles with an overactive immune system if you're among those pestered by allergies. Also, if you enjoyed today's video, give us a thumbs up and subscribe if you haven't already. Let us know down in the comments if there's any subject you want us to cover in the future. See you in the next video.